My name is Kanyisa Boy. I am Project Liaison for the Sexual and Reproductive Health for Your Information campaign. The Sexual and Reproductive Health for Your Information campaign aims to give you information, simple information on menstruation, safer sex, contraceptives, and comprehensive abortion care. So today we're tackling comprehensive abortion care. So it happens that you have a sexual encounter, the condom falls to the wayside, or your contraceptive does not work. This thing happens, could be because of antibiotics or these herbal teas that we take to detox, and you find that a month later, period dololo, or you are having a period and it's a spot or two for 2 days. The best thing that you can do for yourself is go and test for pregnancy. Once you've tested for pregnancy, you can either have a negative result, and if you have a negative result, it is time for you to think about contraceptive counseling. Contraceptive counseling is for you to find out which options are available to you, and you choose the one that you know will work best for you. We all know that contraceptive is trial and error, so the more you try, the better you find one that is best for you. So it could be a patch, it could be an implant-on, it could be an injection, it could be a tablet. So you work until you find the one that works best for your body. So if you've got a negative result, perfect. Go for that counseling, get the best contraceptive for you. Then we go to a positive result. It's either there's an alarm ringing and you are lightheaded and you're thinking, what is a girl to do? Fine. So do you now want to keep this pregnancy? If you choose to keep the pregnancy, please make sure that you go for antenatal care at your nearest clinic that offers this. Pregnancy generally lasts for 38 to 40 weeks, and beyond 40 weeks you still have to go for your checkups to make sure that everything is fine. Should you choose not to keep the pregnancy, you need to go to a safe abortion facility. Now, in South Africa, it is legal to end a pregnancy with an abortion. So from 0 to 12 weeks, you walk into a clinic, you request to have abortion services. You should not be questioned about why you want to do it, what are you thinking, at your age, and all these weird and wonderful things that we generally come across. You should be getting this service without any questions. Beyond 12 weeks, 13 to 20 weeks, it is generally at the health professional's discretion. Here they think about your finances, your mental health, the viability of the pregnancy as well. So generally this is the time where we struggle to access abortion, because most hospitals, if you're in Gauteng, there's only 5 that offer abortion beyond 12 weeks. It is incredibly important for you to test for a pregnancy early, and to also make sure that you access the abortion service should you choose it as early as possible. Now let's go into the service itself. The first thing that is important is counseling. Counseling is for you to think about your options and weigh them properly. This is the first part. It is important that if it is not given to you, that you request counseling, because according to South African law, you should be getting abortion counseling. Beyond counseling, you have a right to information. Here we're talking about what happens during the abortion process. What are you going to get in terms of pain management? Please remember, you do have the right to pain management. Thirdly, you have a responsibility to share any pre-existing medical conditions. It could be the flu, it could be that you have had an STI, it could be that you have a cesarean section, it could be that you have blood pressure, blood sugar, or a cancer, because it is important for the health professional to know any pre-existing conditions so that they can assist you accordingly. Now you've had the service. Beyond the service, you need to go back to make sure that everything has gone well, that the abortion is complete. Additionally, if it is not offered to you, you have a responsibility again to request contraceptive counseling. Contraceptive counseling is for you to plan, firstly, whether or not beyond the abortion you want to have another pregnancy, and when you would like to have this pregnancy. And if you choose that you do not want to have children at all, then also you need to consider much longer lasting contraceptive options or permanent contraceptive option, which is sterilization. Please remember that abortion is a health procedure, and it is legal, and it is a human right. Nobody should deny you the service. If a clinic does not offer abortion services, they have a responsibility to refer you. If a nurse is supposed to give you the service because they either think that you have been risque or perhaps you're too young, it is called obstruction to care, and you can report this at the Human Rights Commission. Thank you very much for spending time with us. The next one will be on contraceptives.